Hello, this is Group 6, and we're presenting on metformin. So metformin has several brand names. There's glucophage, glucophage XR, Fortamet, Glumetza, and Riomet. And obviously the generic name is metformin. The drug classification for metformin is antibiotics, but specifically it's considered a biguanide, which means that it targets type 2 diabetes specifically. The therapeutic effects of metformin is that it's used to treat diabetes, and it is often prescribed in conjunction with a change in diet and exercise. Moving on to the pregnancy, the effects of metformin on pregnancy. Although it is generally very well tolerated, the effects of metformin during pregnancy is not fully understood. That said, serious side effects are very rare, even in pregnant women. The risk in pregnant women with type 2 diabetes is significantly higher than gestational diabetes. However, metformin is the preferred drug over insulin in both gestational and type 2 diabetes in pregnant women. It is not recommended for non-diabetic pregnant women with obesity or during lactation and breastfeeding because it can enter the breast milk.
The mechanism of action of metformin is interesting as it is different from other anti-diabetic medications. Metformin works through three methods: decreasing glucose, one, by decreasing hepatic glucose production, two, by decreasing intestinal absorption of glucose, and three, by improving insulin sensitivity by increasing peripheral glucose uptake and utilization. Moving on to pharmacokinetics. Absorption, about 50 to 60% of dose reaches systemic circulation, distributed to most of the tissue and not metabolized. Primary excretion is at kidney. Route is oral and take once or twice a daily. We have immediate release and extended release. All different trade names drug have different doses as it shows on the slide.
Although side effects can be annoying, they may be a price to pay for many benefits you're getting. Typically, most of the side effects usually will go away within a week or two. And some common side effects include metallic taste in your mouth and appetite reduction, abdominal discomfort, or diarrhea. It is possible with the prolonged use of metformin to develop B12 deficiency, as well as nausea, vomiting, anorexia, agitation, excessive exertion, and rash. And out of all the adverse side effects, lactic acidosis is a common noise around metformin, but it is very rare. The contraindications include concurrent serious infections, fever, trauma, gastroparesis, and those who suffer from organ dysfunction and congestive heart failure or hyperthyroidism and renal failure are at greater risk of developing lactic acidosis. If symptoms of lactic acidosis occur, you should get immediate emergency medical help. And do not take other medications unless they have been discussed with your doctor. This especially includes non-prescription medications such as aspirin or medicine for appetite control, asthma, colds, and cough, hay fever, or sinus problems.
Okay, so it's really important to know that vitamin B12 and folic acid, the absorption of those can decrease while on metformin. And then some common food interactions with metformin is garlic and ginseng, which increase the hypoglycemic effect of metformin. In addition to that, there's also drug interactions. So we just want to make sure that our patients know that alcohol is one of those things, as well as ACE inhibitors, diuretics, antihypertensives, calcium channel blockers, antihistamines, antacids, blood pressure medications, antibiotics. As you can see from this list, there's quite a lot of different drug interactions that could be had. And then those drug interactions can cause either an increased risk for hypoglycemia, decrease in renal excretion of metformin, or a decrease in blood level of metformin. Now we'll just talk a little bit about some of the nursing responsibilities. It's really important to teach our patients that if they have any itching, rashes, or swelling, particularly in the face, tongue, or flushing, or throat tightness, difficulty breathing, that they should report that immediately, as well as reporting any nausea, vomiting, yellowing of the skin or sclera, abdominal pain, light clay-colored stools, or darkening of the urine. And then in addition to that, we also want to teach them to always carry quick-acting carbohydrates. That way, if their blood glucose levels get low, they have a backup. And then to increase activity, that will help bring down their blood glucose levels, as well as bringing down the chance of obesity, which is an important factor in diabetes. And then to always continue to monitor their glucose levels, especially before and after exercise. And then lastly, some important lab tests is the vitamin B12 lab. Deficiency can sometimes occur with the long-term use of metformin, especially in patients with anemia or peripheral neuropathy. This is what our patient education brochure looks like. So we talk a little bit about the emergency signs and symptoms, what metformin is, when it should be taken, what absorption looks like, that alcohol should be avoided. And then on the other side, we talk about what diabetes is, some of the common side effects of metformin, and then smart choices to be aware of, like exercise, and then quick acting carbohydrates and lab work. And then lastly is our reference page, and that's everything.